Hello and welcome to the third edition of Half Hour, a podcast starring me, John Paul Legitimacy, as your host. In today's episode, I'll discuss drugs in the human body with my friend and good fellow, John Salmeron. We went to high school together and middle school. I'm just going to let you take it away, man. Like, tell us about where you work, like, what you're doing, like, are you in school, like how's it been, man?
I'm doing pretty good. I currently go to MCPHS University. I am going into my fifth year of pharmacy school, 5 out of 6 years. Once I graduate, I'll get my PharmD. I also currently work at Boston Children's Hospital. I'm a pharmacy intern there. I also joined an organization recently. I'm wearing the shirt, as you can tell. I'm Phi Delta Chi. I recently became president, and I'm starting my term in this upcoming semester.
That's awesome, man. I'm happy to hear that because I'm also president of my university. So it's kind of cool. We have two presidents sitting here at the table. You know what I mean? But tell me about why you decided to go to like this school. Like what? I know you always said you wanted to pursue like the pharmaceutical industry, but like why MCP?
So when I was younger, about I would say 16, 17 years old, I was in my senior year of high school. I'm not sure if you remember. I wasn't doing too good in school. The only class I really ever enjoyed was chemistry. I loved doing chemistry. It was awesome to me. But going forward, I was in a honors chemistry class and a CP2 math class, and I didn't know what I wanted to do with my life. I was planning on going to Castleton University to just wrestle because I like to wrestle, or I
You
was.
did that in high school. Like it was like your sport. Like that's what you did. I remember.
Yeah, it was my favorite sport. So it was between that and graduate with a business degree or go to the military, and I really didn't know what I wanted to do at all. So I met my stepfather's aunt, so my step aunt, and she was a pharmacist, and she was telling me, "Oh, you should do pharmacy. It's something you'd like. You like anatomy?"
Oh, so that was like the inspiration for you, kind of like in maybe you heard more about it from her.
I didn't hear too much about it. Like I said, I really didn't know too much about what I wanted to do. But she said, you like anatomy and you like chemistry, so you should be a pharmacist. You're a legal drug dealer. And I was like, I don't know what I should do. She said you would have technically a doctorate degree, referred to as doctor. And she said it's an awesome job. She has a lot of fun. She enjoys working with her patients. And I was like, hey, why not? I have no other plans, so let me look for the first pharmacy school I can find. And I looked into Albany College of Pharmacy. That was a little bit too far. I didn't want to go all the way to New York. And I saw Massachusetts College of Pharmacy, which is right down the street. And I just said, hey, why not?
Yeah, I mean, it sounds like you kind of had like this impression from her, and like she like really kind of like it kind of planted a seed in your head, if you will.
Yeah.
Just today, I was at work, and I was walking by the CVS, and I saw like a prescription paper like just on the ground. And I know that these things are confidential, so I actually went inside. I also was like, I was on my way to the Big Y. I was getting an apple, like my typical kind of work day. So I just made a little detour. I picked this thing up and I go into the back of the CVS with the pharmacy, and I'm like, hey, like I don't know. It was really thick. It was like an envelope with like the all the information on it, and the guy's name and his address and like all these things. And I was like, okay, like I'm just gonna hand this to them. So I handed it to her. I'm like, hey, I know it's confidential. Like I just found this outside. And she's like, okay, I'll just throw it away. I didn't know if it was like a file or something that they might keep. But I guess I'm kind of glad I did that because I know that, pharmaceuticals and stuff, like, they are very private, and the sheer multitude of drugs out there. There's a lot.
They can tell you a lot about a person.
What have you learned, like, about specific drugs? Like, what is like, some information you know about, maybe, drugs that, maybe a lot of people take these, like, for example, like, one of my family members takes, like, Crestor, and that helps with his or her condition. So that's, like, one example. That's not something, is that something you'd find behind the counter, or is that something you'd find, like, on the shelf?
Crestor is a medication that's prescription only.
Okay, so you have to get it from behind the counter.
Yeah, it's basically it's a cholesterol medication. So yeah, it kind of in itself tells you what it is. I believe it's a statin if I remember correctly, and it just lowers your cholesterol. But what I have learned the most is maybe not necessarily more about drugs, because you can really look up any drug and see what it does online. It'll give you a very brief answer. It doesn't tell you exactly what it does or its like adverse effects. I think I've learned more that pharmacy is a lot more than just a man sitting behind the counter with a white coat on, just counting pills and just selling them to you, or just checking pills. Definitely a lot more than that. There's compounding pharmacies that are more so for unstable medications that can't really be packaged up and put on a shelf for a long time. You have to like make them with a mortar and pestle on hand. It can be creams, it can be pills, and these are like specialty pharmacies, I believe they are as well, where yeah, it's like the less common medications that you wouldn't see, not your everyday person would be taking. Like Crestor, for example, is a medication that you could walk down the street and like there'd be hundreds of people that take these medications, or like blood pressure medications. These are more like I can't give you an exact condition at the top of my head, but just the more rare conditions.
Yeah.
There's also hospital, and you can work in hospital pharmacy, which is you can do internal med, which is where you go on rounds with doctors and you go to each patient, and you're basically part of a team of doctors, and you consult about what can we do to make this patient have the best possible health outcome, and you take a look at their med list. You speak with your healthcare team, and you discuss, can we take this off? Oh, there's a drug-drug interaction here. What can we add to make this better? Why is this person having these adverse reactions or these symptoms? Maybe it's because of this drug or because of this drug. There's so many different branches. There's industry too, which is more of the manufacturing part of pharmacy. It's like discovering new drugs. Like, for example, in my fraternity, my big is going into organic chemistry, and he's looking into new drugs to create. I don't know if he's okay with me discussing what he's working on openly, but there's that side where you work with chemists and pharmacists work together, and they put their knowledge together to basically synthesize new drugs that haven't been out yet, and they put them through clinical trials, which take like 10 to 20 years. And there's just so many different fields of pharmacy, but the one that people see most is definitely the person in Rite Aid or CVS just counting.
Yeah.
That's what. There's a lot more to it, but that's what your average person will see. So I think that's what I've learned most about pharmacy, and of course I've learned a lot about drugs and the human body as well. But I think that's a big misconception that people don't often think about.
Well, when you were talking right there, all I could think about was first how I had no idea that some of these, medications and prescriptions and pharmaceutical drugs, can't just sit on the shelf for a long time. Like, I didn't know that there was so much about, crushing it into a powder and mixing a cream, and doing these specific things that have like time limits on them.
Mm-hmm.
So from what I'm gathering, it's like this is a really interesting profession because you're really helping people, get through their day with their specific needs. And it's also cutting edge. This is something where you're actually helping people, but it's cutting edge. Like we're learning new things, I bet, every day. Neither of us are experts in our field, and you know a lot more than I do, obviously. And like, for example, in the past 2 episodes, we talked about history and culture and travel, and those things I can kind of relate to and talk more about. But it's really cool to be like learning more about this this specific field. It's just so interesting to me that people can get into a field that is just so really important. But kind of moving on, or not moving on, but kind of like shifting gears a little bit. Do you kind of work in this kind of department you said Boston Children's, right? Do you work in this department, or is it more like you do in general things? Like tell us more about like your work there and like, like your typical everyday and like maybe some things that you're learning, or like, do you have any interactions with doctors and things like that?
Mm-hmm. So in the line of work that I do at Boston Children's, it's each day is a little bit the same but different. So you have a lot of different shifts. So I can have one shift where I am in the pharmacy and I am taking bottles of solutions of drugs and basically drawing them up into oral syringes and preparing them for someone who might not be able to take an oral tablet. These are called just different dosage forms. So depending on like the patient's limitations, like say they're unconscious, you might need an IV injection. Say they can't take oral medications because they're vomiting, you have other methods like suppositories, you have creams, other methods of injection.
What's a suppository?
A suppository is it's basically like a pill, or I can't explain exactly what it is, or a capsule that you would insert through the rectum, and the portal, it bypasses the portal vein if it goes a certain depth inside, and it's basically just absorbed systemically through the anus.
I feel like that's a term I should have known, but here we are.
Mm-hmm.
And you said an oral syringe. Is that just a syringe that works within the mouth?
So the word syringe is basically it's a tool used to draw something up. The needle on the end is what people usually think about a syringe, like a syringe you inject yourself with.
Yeah.
But an oral syringe, it's more so just a little tube, and you just pull on one end, and it draws up a liquid.
Oh, so like the draw tube and like, those
Yeah.
classic science experiments.
Yes,
Okay.
it's exactly what it is.
Mhm.
But there's no needle on the end of the one that I'm
Oh,
on
I
the
see.
oral syringe.
Okay.
So when you have like a small child and you like put a little syringe in their mouth and you like dispense a medication and it's just a liquid, it's like that.
Okay.
But it's for, like I said, it's for like younger children who can't take tablets or pills or they have no teeth, for example, neonates. So one day I can work on that. I can also work on restocking Pyxis machines, which is basically like, think of a dispensing machine for drugs that is on almost every corner of an ICU, or just in med rooms. There's also Omnicell. It's just a dispensing machine. You walk in and you pick what you need. You also obviously need like authorization, but
Of course.
you can do that. I can stock those. I work with narcotic medications. It's this thing called the narc run. I'm not gonna get too into it, but I can also work into the IV room, which is something I haven't gotten too much training on. But you get dressed in it's called a bunny suit. You get a gown, you get gloves, you get the booties on your
The
feet.
whole getup.
The whole everything.
Yeah, okay.
And you have to like sanitize yourself when you walk into the airlock chamber.
So it's kind of like the same thing they do at NASA when they're working on the probes. Like when they don't want to get the germs on there, they like go into like, these different pressure rooms and like and
Yes.
like,
So
the germs go away.
they don't necessarily go away. The pressure room, it's called a positive pressure room. So the pressure inside of the IV room, excuse me, is higher than the pressure on the outside of the IV room. So what happens is when a door opens, do you understand how pressure gradients work, Le Chatelier's principle? So when you have a area
You're
of
gonna have to
higher
expand
concentration and an area of lower concentration, they're naturally going to want to dissipate.
Of course, and equalize.
Yep.
Okay.
So basically what happens is the positive pressure room has higher pressure, lower pressure room has lower pressure. So when you
And
open
the room you go into is higher pressure.
the room you go into to prepare the medications is higher pressure. Yes.
Is there a reason for that?
Yes, I'm getting into it.
Okay.
So what happens is the door will open, and because the room has higher pressure, all of the air is going to rush out. And
Okay.
what the air rushing out does is it keeps any potential pathogens or I can't pronounce the word.
Contaminants.
Yes, from getting in because there's so much air just rushing out.
So the act of the air moving is a mechanical mechanism by which to like push all the pathogens in the air out.
Yes,
And
so
you're wearing a mask, obviously, and
Yeah.
the whole thing.
yes.
Okay, so it makes sense to me. Like I can picture it.
Yep, so when you're inside the room it doesn't feel like anything. But if you're on the outside and there's like a partition and a window, it opens, you will be blasted with air in the face. So all your hair is moving back. It's just like there's air going everywhere. Like it makes papers fly everywhere.
Okay.
Back in the pharmacy. But you can also go in there and prepare IV bags, special IV solutions, and these syringes would be injected into someone as they're sterile. And yeah, so overall it's basically, to simplify it, preparation and delivery of medications. So I'll go around the hospital and I'll see like children. I'll go to the chemotherapy unit. I'll see children there.
That must be awful.
It's definitely an awful thing to see, of course.
Yeah.
But as you get desensitized to it when you see it every single day.
Of course.
But
yeah.
it definitely it still hurts your heart a little bit
Yeah.
when you walk into the neonatal ICU and you see a child who's not even 3 months old yet with like a bunch of like wires and like tubes and just everything like all over them, and they're just unconscious, and when they wake up they're like screaming in pain.
Yeah,
And
it's
it's
awful.
it's very sad to see. But I've also walked into procedure rooms while it's happening. It's really interesting to see.
So I feel like you see a lot here. This is a pretty cool place to work. I work at a liquor store currently. I talk to some interesting people there, but I probably not as interesting or informative as some of the people that you meet there. I mean, I know that Boston Children's is a very famous hospital, especially for kids. It's in the name. It's like very international, right? Like people from all over the world come into this place.
Yep, I see people from all over the world. I don't exactly interact with them, but I do see them when I walk around, because I don't have much patient interaction unless I'm saying like a hi or hello, or
okay,
I see a child in the hallway. For example, he was playing baseball with his parents, and the ball rolled over to me, and I pitched him the ball, and he smacked it, and it just like hit the ceiling tile, and I was like, oh, probably shouldn't have done that.
Well, now I'm thinking about, like, imagine it hits a piece of equipment and then the equipment falls down, or like, but of course we were just messing around.
Mm-hmm.
What is like a really interesting experience you had there?
I definitely think a really interesting experience that I had was walking into one of the procedure rooms when I was on a Pyxis delivery. I was restocking their medication machine.
Pyxis is a medication.
Pyxis is, think of a vending machine for drugs.
Okay.
So nurse will walk up to it and like press like what they need. They'll type in their credentials, like see.
Of course.
Yep.
Yeah.
And then it'll open up and they just take what they need. We record it and they close it up and they walk away and go administer it to their patient. But something that really stuck out to me was definitely a doctor was preparing. He was just preparing. Preparing. I'm sorry. What do you call it? Preparing a patient for a catheter insert. Do you know what a central line is? A central line is basically a catheter that's inserted. I believe it's through the arm, and it goes directly into, like, I believe it's to the aorta. So the drug is dispensed directly, like, in the vicinity of the heart, and then it gets absorbed systemically, which means throughout the body. Because
I've seen like images of that before, but I didn't know obviously what it was. I was thinking of the other catheter, which is definitely
no. So a catheter is basically, I don't know the exact definition, but when you have a line in your arm, they put it into your vein.
Technically, an IV is a catheter.
Yeah, it's a catheter.
Yeah,
yep.
Okay.
So, but this is called the central line. So they put the catheter in, and it dispenses medication directly to the heart.
So when did it end up happening?
Nothing really ended up happening. I just walked in and I see a doctor like casually talking with like his coworkers because he does this every single day. He's an expert. This isn't anything new to him. To me, it was very interesting because I see an unconscious person with an arm like sticking out and blood all over it, and he's casually just wiping it away, like, just talking to his coworkers so like nonchalantly because this is something
he does this all the time.
He does this all the time. It's not weird to him.
Yeah.
And then I'm walking in and I see this and I'm like, wow, like this is crazy to me. It's like it's insane. This person is just under anesthesia and like having this done to them. And they're so nonchalant about it because they do this every day. And
it's amazing how the human body can just, like, I don't want to say accept, but there are outside forces. Like, for example, there's an outside force going in, and it's so interesting to me how our science has come so far, and we're really able to do a lot of life-saving procedures that, hey, maybe 200 or 300 years ago, that would have been it for you. During the Civil War, they were chopping people's arms off because, like, they didn't know what to do with the infections and all these, like, other, like, issues. But you're part of this, really, like you are, and all the millions and millions of people in the U.S. that work in the healthcare industry. You guys are really like the front line, like pushing it forward. So I'm going to say thank you. But also, what kind of effect has COVID had on the kind of operability of the hospital? I don't think you were there before COVID, right? Like maybe.
I was there when COVID started, and
okay.
Social distancing was definitely enforced a lot. Obviously, it's a hospital.
Yeah, world-class hospital, I can imagine.
But other than that, nothing too much has changed from when COVID first started because, as you know, we work with people who are immunocompromised. So, for example, when we walk into the chemotherapy unit, there's two sets of doors, and you open one set of doors, and then it has to completely close behind you before you're allowed to open the next door to prevent anything from outside coming in.
Coming in and like
yep.
hurting these people.
Because your average cold, your common cold that probably wouldn't even phase me and you could like take the life of one of these patients because their immune system is so suppressed by not only their chemotherapy medications but any other medications they're taking, just immunosuppressive medications, so they can't fight off your average common cold as well as we can, and they might be more susceptible to certain infections that we normally wouldn't get, but they're a lot more susceptible to getting it, so we don't necessarily have the best treatment options because it's such a rare disease that your average person wouldn't get.
Did you hear about how I'm not going to say discovered the cure to cancer because that would go all over the news, but there was a study that was done where a group of people who had prostate cancer, they all took some sort of drug. I don't know if you heard of this, and it cleared their symptoms within 6 months, but it was probably I think some of the factors included like the prostate cancer wasn't so advanced. I know prostate cancer is not one that is so like something that could kill you so easily, like if you catch it early. So it's like, is it one of those cancers that isn't? I don't want to say isn't so deadly, but it's not like lung cancer or brain cancer. Like it's a little different. But these people, like they took this drug, and I read about it on the news, and their symptoms cleared, and I think most of these people, maybe with the exception of one or even all of them. I don't know if you read about this on the news, but
I haven't heard about that, but prostate cancer, it's if like any cancer, if it's caught early, it's definitely something that can be corrected. I don't want to say it's less deadly than any other type.
you have a better chance though if you.
Yeah, I would agree with that.
Yeah.
But no, I'm not too sure about that. But yeah, you do have more ways to treat enlarged prostates and cancer in prostate and breast regions with more than just chemotherapy. You can also use hormonal therapy, which is basically a way to block estrogen receptors, for example, in the breast, because birth controls actually increase your chance of breast cancer because it increases growth in the breast and in the uterus and the ovaries. And as for men, testosterone increases the growth of your prostate. So it would as you get older in men, you're very likely to have not necessarily prostate cancer, but an enlarged prostate, which could eventually lead to cancer and urination problems. But like I was saying before, a lot of these drugs have hormonal therapy to basically block these receptors so they don't keep getting stimulated by their designated ligands, which is basically like your activator, so like estrogen for the breast. And it's one way to suppress the growth of these and to suppress the cancers.
So what I know that when you go into chemo and you know people lose their hair, what other effects on the body does chemo have?
Okay, so basically the way chemotherapy works is it will target rapidly dividing cells. So that's why your hair goes away. And it targets rapidly dividing cells to eliminate the rapidly dividing cells that would be found in wherever your cancer.
Yeah, that is cancer. Like it,
yep.
Right, like yeah.
So it basically depending on what type of medication it is, there's multiple classes of chemotherapy medications. They will attack a different part of the cancer cell while it's dividing. So if you have, for example, a cardiac cell, which wouldn't really be dividing, that might not be affected as much as your hair cells, which are always dividing. They're always trying to grow new hair.
So it's kind of like this process, like this chemotherapy. It's more of like a shotgun kind of to these rapidly dividing cells. So like your hair, for example, falls into that category, but it's not necessarily something you want to get rid of. It's just like this is what you have to do with chemotherapy because it just wipes out.
So not only does it affect your hair, it affects your skin as well, and it'll make it harder to heal too because, like I said, it targets rapidly dividing cells.
So if you get a cut, it's a little more serious.
It might be, and you're also immunocompromised too because, like I said, rapidly dividing cells are attacked. So would for example, your immune cells were rapidly dividing, or your blood cells, which are rapidly dividing cells, or your fingernails would also be targeted because, once again, they're rapidly dividing.
Quick aside, are platelets biological, or are they? Well, they're obviously biological. They're produced by your body.
Yes.
But are they like alive, or are they just kind of like? I know they're blockers to block like cuts on your arm, for example. Like if I got a cut on my arm, it would the platelets would eventually come in and kind of like help block it up. But they're not like, are they themselves cells, or are they just...
Platelets are fragments of cells. I can't remember the exact cell off the top of my head, but it basically, this cell forms platelets as pieces of it break off, and there's different factors that will activate them, and they can aggregate, and by doing that, they will stick to your collagen, which is what's exposed when you have an injury. And one activates one. It's basically like a complement cascade. One activates one, the other one gets activated, and they'll basically just form a clot, and they will stick to where the site of injury is. So we have drugs to target those clotting factors, is what they call them. Like there's factor 10, there's factor 7, factor 10A, there's a bunch of them. So drugs like warfarin and aspirin will take this process and basically like bring it down. So people who are more likely to get blood clots or strokes, that's why they're required to be on these medications. But to answer your question, no, they're not alive. They are fragments of other cells.
And so they're just being used to kind of like hold the line, if you will.
Yeah, so they basically, it's like you have a hole in your body, and they basically, like a cork, they plug the hole while the other cells can come in and continue the healing process.
Okay. So, dude, it is so interesting. I mean, we've talked about this ad nauseum before. The human body is so complex. Like,
Very.
I hear that. How many neurons do we have?
I don't know exactly off the top of my head, but you're right. It's insane how the human body works, especially the immune system, which is one of my favorite. It's just insane. There's so many like little bits and pieces that all work together to accomplish this one thing, and it's unbelievable. And a lot of people don't know about it.
It makes me really excited for the future, just because I really think that we're going to continue making great advancements. A little aside though, like there's a picture I saw of how galaxies interact, and they form these massive like web structures. You know, if you were to really zoom out at the universe, or at some level, you could see these web structures like dominating the universe, and they almost look like how neurons in those pictures now, they like kind of like interact like that. Like these structures, they kind of repeat. Very fascinating to me.
I agree with that. If you look at the stem of a leaf, it kind of looks like veins. Like I feel like a lot of these things look very similar. Like for example, like atoms, I feel like you can kind of relate them to planets, where they have basically a central nucleus, and then things like electrons, protons, and neutrons not neutrons, but electrons will revolve around them. And it's just, you can really relate it to planets, how we have they have orbits, and something you would know a lot more about than I would.
Yeah.
It's crazy how a lot of things really correlate.
It's a rhythm.
Mm-hmm.
It's a rhythm.
Yep.
To me, it's just so fascinating. Like we have a lot to learn still about the human body. I know that in certain ways, like, you know, people have been living longer, right? Like that's a trend that we've been seeing for like quite some time.
Yeah.
Would that be something that's attributable to, like, you know, improving human conditions, like, or do you think that drugs have had more of an effect on the like advancement of human life, or do you think it's like the cleanlier conditions? Like, for example, like George Washington was in Valley Forge with the army, and one of the European generals came in. I forget his name. Whoever it was, he came in and basically helped the troops like dig, you know, like trenches so that they could defecate in, and like use the bathroom away from where they eat. Essentially, like he taught the Americans a lot of these strategies, like in the very first days of the U.S. Armed Forces.
So I will say that drugs have definitely helped in extending the human life, of course. So as technology and just, you know, medications. I will say that the overall cleanliness and making it easier for humans to survive and to stay in life maybe wouldn't be ideal if you were to take these people that we have today and how we've evolved and put them back, say, 100 years, because
we'd be in a tough spot.
We would be in a tough spot. A lot of the reason that, I don't know if you've noticed, a lot of people have gotten sick after pandemic restrictions have eased. It's because your immune system is very similar to a muscle. The more pathogens you're exposed to, the more like diseases you see, the stronger your immune system gets, and it gets better at its job, as opposed to someone who grew up in a city, super clean, never seen anything dirty in their life, never, I don't know, played football in mud, never had animals. Their immune system might not be as good. So it's kind of like a double-edged sword, where you might be going not necessarily the most favorable way in terms of evolution, but in terms of technology and drugs, it's definitely helping us counteract that.
So kind of the mask wearing afflicted people's immune system's ability to respond in the veracity or capacity that it did before. I mean, not everybody, of course, but, you know, in general, like, you know, if I, you know, when the pandemic started, if I just refused to take off a mask, and then suddenly I took it off, I could get sick very easily.
So a mask, from what I've heard in the past, a mask does not protect you from other people. Mm-hmm. It protects other people from you, because when you speak, the particles that you spit
Droplets.
out come out. Yep, the droplets, the air droplets.
Is it true that a sneeze is 250 miles an hour? Is
I'm not.
that true? Like,
I'm not sure. I
That's
haven't looked
fast.
into that, but it does move very fast, and it does move very far as well. But like I
It's funny
said,
to me, like the human body can do that.
think of your immune system like a muscle. If you work out every single day for the past 20 years of your life, and then all of a sudden for 2 years you just stop training completely, and then you get thrown into the same, say, football game that you were playing in the past 2 years. Say you get thrown into the same scenario, and you're expected to perform the same results. It's not going to be easy
Yeah, it's not
because
gonna
you
be.
haven't been trained. So you've been getting weaker, and you've just been kind of like laying around doing nothing. It's going to be a lot harder for you.
But the foundation's still there. Like, it's still in there somewhere. It's just you have to build the house up again, if you will.
I would say with the evolving of bacteria, evolving of viruses, different strains of
This is true. What is this about? Bacteria are of penicillin. Okay, they're getting around penicillin easier. Like this we're breeding super bacteria with hand sanitizers and penicillin, right? Like that. Like it can they can evolve this way.
it comes to the overuse of antibiotics. So when someone is sick, they go straight to the doctor. Oh, give me all of the antibiotics that you can, help me feel better. And a lot of doctors will just give them out, and then
Right.
people will take these antibiotics, and the second they feel better, they'll stop taking their antibiotics. So in the first round that you're taking the antibiotics, all the, say, bacteria that is susceptible to that penicillin will be eliminated. But if you stop taking it when you feel better, that bacteria that survived is still there. And there's something that made that bacteria better at surviving the exposure to the antibiotic than the one that didn't survive. And because of that, survival of the fittest, I'm sure you know what that is, comes into play. And the ones that were able to survive the exposure are able to replicate, and their offsprings are going to be better at resisting this antibiotic than the ones that didn't make it. Yep. And then with that being said, say you do the same thing again, and you give the same antibiotic, and you eliminate all the ones that would be susceptible to this antibiotic. There's still going to be a small group that survived because they were better at resisting this antibiotic.
And
then,
this process replicates.
yep,
over
over time, and the more and more you go on, you get things like MRSA, which is methicillin resistant, Staphylococcus aureus, which staph can be found on your skin.
A lot of Latin there.
Yep. And that's how antibiotics have been getting weaker over time. It's the misuse, over prescribing of them,
Yeah.
and their use in everyday. You consume more antibiotics than you think.
Yeah,
So like
yeah.
a lot of like.
It's in the food, right? Like.
Yep. A lot of poultry and animals that are killed to be fed to people. I don't know what the process is called. They're fed tons of antibiotics, and this is something that's also building on that antibiotic resistance, and it's just making everything worse. And it's not as easy to keep up with the making of new antibiotics with how fast they're being resisted. You see what I'm saying? And yeah, that's how it works. It's kind of scary to think about.
Well, man, we're over the 30 minutes. It's clear to me that you're gonna be an excellent person in this field. I think you've enlightened a lot of people. I think a lot of people might listen to this and feel like they've heard some good information today. Obviously, you're not giving any medical advice or anything that you should do, like any at-home remedy use. We're just talking, having a conversation.
Not until I graduate.
All right, man. Well, thank you for coming on the show. I really
Yes.
appreciate it. Hope to have you on again.
Thank you for having me.